This is the pulse measuring activity called the heart beats on.
Hi, I'm Mitchell.
I'm Abdel.
I'm Brooke.
And I'm Nick Getz. Biomedical engineering is a field of study that uses math, science, and engineering principles to design devices that are used in healthcare. There are several tracks within biomedical engineering that include biomaterials and tissue engineering, biomechanics, bioinstrumentation, and biomedical imaging. Today we'll be exploring the bioinstrumentation. We will start out with an introduction and background on the cardiovascular system, followed by two activities to measure our pulse and talk about how our pulse, what it means in medical devices. Feel free to stop and pause this video to look at any of the pictures in more detail at any point. The cardiovascular system transports blood throughout the body using the heart and blood vessels. The heart is a muscle located slightly to the left of the middle of the chest. It's about the size of your fist, and the heart sends blood around the body. The average human heart beats over 30 million times a year. The cardiovascular system. The right side of the heart pumps deoxygenated blood from the body to the lungs, and the left side of the heart receives the blood from the lungs and pumps it to the body.
An artery is a large blood vessel with muscular walls that transports oxygenated blood from the heart to the rest of the body. Once the oxygen has been delivered to the cells through the capillaries, deoxygenated blood is carried back to the heart by the veins, where it is taken to the lungs to get more oxygen, and the cycle begins again. With every heartbeat, new oxygenated blood is pumped by the heart, causing blood to surge forward in the arteries. These rhythmic surges of blood, which travel from the heart to the rest of the body, are called a pulse. The pulse can be felt in places where arteries are close to the surface of the skin. The pulse is most commonly taken in the carotid artery in the neck and the radial artery in the wrist, but can also be taken in a few other places as well. Despite being very closely related, pulse and heart rate are not exactly the same. The heart rate is the speed at which the heart contracts and relaxes, whereas the pulse rate is the rate at which an artery expands and contracts when blood passes through. A normal resting heart rate in an adult is usually between 60 to 100 beats per minute. On the other hand, a well-trained athlete might have an average heart rate between 40 and 60 beats per minute. Heart rate can also vary with age. Understanding pulse and heart rate can be important because it can give information about if the heart is healthy. Learning about the heart is important because heart disease is the most common cause of death worldwide. In 2017, 30.3 million adults in the United States were diagnosed with heart disease. For this reason, it's important to be aware of pulse and heart rate. In the next section of this activity, you'll learn how to take your own pulse. I'll let Mitchell start the demonstration.
Thank you. So on the right side, you can see a picture with a person who you can see all of their arteries. These are specifically the arteries which happen to be rather close to the surface, so they're easier to measure. The ones of note are the carotid, the brachial, and the radial artery. These are the ones that are in the crux of the elbow, the neck, and your wrist. So here we're going to watch some
Find the
videos
carotid
where you can
pulse,
try it yourself.
locate the patient's
first one's
trachea,
the carotid artery.
also known as the windpipe, in the center of the neck. Using two fingers, slide into the groove and apply gentle pressure until you feel a thump. This is the carotid pulse. A few important things to note: you can check the pulse on either side of the trachea, but only do one side at a time, as you don't want to occlude blood flow to the brain. Also, use your index and middle finger and not your thumb.
Now we'll watch the brachial artery.
Find the brachial pulse, slide two fingers over the bicep until you feel the indentation. Apply gentle pressure and press slightly upwards. You should feel a thump. If you don't, slightly move the location of your fingers or press harder. This is how you find the brachial pulse.
And finally, the radial artery.
To find the radial pulse, place your fingers over the radius until you feel the groove that's created, using two fingers and not your thumb. Press down until you feel the thump that's created by partially occluding the artery. This is the radial pulse, and it's used to measure the heart rate. To find the radial.
So finally, some conclusions from this activity. We know that the pulse is most commonly taken at the carotid artery in the neck, or the radial or brachial artery in the wrist and the elbow. There are some other locations that you can do this as well, like the popliteal artery, which is behind the knee. The heartbeat also changes speed to meet oxygen demands of the body. So for example, while we're all sitting here, it could be quite low, but if we were to stand up and move around, it would likely increase by quite a bit. So heart rate can also vary with level of physical fitness. So somebody who is not super fit might have a higher average heart rate than like a well-trained athlete who would have something closer to 40 to 60. We also know that heart rate can vary pretty wildly with age. So a newborn baby might have a heart rate between 100 to 150, while like an adult of normal physical fitness would have something like 70. And now I'll pass it on to Abdel, who's going to talk to us about some medical devices.
Because blood is pumped throughout the body, how a heart is working can tell us a lot about a patient's overall health. When the heart is pumping blood too fast, more than 100 beats per minute, we say that this heart is tachycardic, which can be a problem. When a heart is pumping blood too slow, less than 60 beats per minute, we say that this heart is bradycardic, which can also be a problem. If a patient's heart is pumping irregularly, then this patient's arteries could be clogged by plaque. Clogged arteries can be a problem too, because they can lead to cardiovascular problems, like heart attacks. Biomedical engineers use the design process to develop different cardiovascular devices. First, they start by asking what the problem is, which could be a patient's irregular heart rhythm. Then they start brainstorming for ideas how to fix that problem by perhaps suggesting monitoring the patient's heart rate. Then they begin planning how to implement that solution. For example, they may suggest placing electrodes on the patient's chest. Then they develop prototypes and begin testing these prototypes. If the device is functioning as the engineers have planned for, then they share it with the world to manufacture it, present it to other engineers, and publish it for other scientists to read about it. There are a variety of cardiovascular medical devices that are available for use. Pulse oximeters are small devices that attach to a finger and measure heart rate and the amount of oxygen in the blood. Stethoscopes are one of the oldest medical devices that are used to this day. They help doctors listen to the heart by picking up the sounds the heart makes. Heart rate monitors can be simple, like those used in fitness devices, or they can be advanced, like those used in hospitals to diagnose patients. Electrocardiograms, or EKGs, are a technology that is used by many heart rate monitors. They look at the heart's electrical impulse using electrodes that are placed on the chest. Pacemakers are small devices that are surgically placed in the chest to help regulate abnormal heart rhythms by giving off small electrical signals. Blood pressure cuffs are wrapped around your arm during regular doctor visits and are used to take important measurements about the blood that relate to health. We can conclude from this part of the activity that engineers use a designing process to create devices that help physicians find out important information about patients' health. Some activities you can do after finishing this video. You can measure the radial pulses of different members in your household and observe how their pulses differ from yours. You can try measuring your carotid or brachial pulse and compare it to your own radial pulse. You can also measure your radial pulse before you go to sleep and observe how it has changed since you measured it during this video. Thanks for watching our video today.